Okay, I want to share some core elements of some different models and tools for renewal. A couple of questions I suggest we all add to our medical history, really just two. And a little bit about ourselves as people and about ourselves as teachers. And then I'm going to share with you something I live by, which takes about a minute to share, and it's the Gandhi, Marley, Rumi, King, Chavez, Hillel rule of life. And we'll do that at the end. I was going to talk about my journey, and I will, but this is the philosophy of the Student-Run Free Clinic project, as well as what I see as an integrative philosophy, that in every one of our actions and reactions, that we're considering how are we empowering. How are we creating an environment in which the other, and as well as ourselves, can take charge of our lives and achieve joy and well-being? How can we create environmental design for the individual? Secondly, how can we be humanistic? Now, to me, humanistic is not just this general words of humanism, but rather it comes from humanistic psychology. Carl Rogers was the father of humanistic psychology, and he said that every encounter should have in it three elements. He said every encounter, whether it's with each other or a patient or a person, should have positive regard. He's the one who coined the phrase unconditional positive regard. Show respect. Even if we don't agree with somebody's behavior, I can be respectful of them as a human being. And to have some empathy. We can never know what someone else is truly feeling. It always drives us crazy when we say, somebody says, I know what you're feeling, like, no, you don't. But, no, anybody ever been in a relationship where your partner says, I know what you're feeling, like, no, you don't. Let me tell you what I'm feeling. So we have to be a little careful with our language with empathy, but to have some sense of what the other person might be feeling. But the most important one that I feel that clinicians need is congruence, is to become self-aware, to become aware of our impact on the other and how we're behaving in the moment, and how, whether we touch somebody gently or not, what we say, and then realizing that medicine, this whole integrative medicine field, medicine is this opportunity to learn and to grow and to become the human beings, because we're privileged to be present when people are dying and with people with chronic illness and with people at these moments, and not to be afraid to recognize that we're growing and learning, and how do we become more effective as people. And it's in that human relationship and that build of trust. What saddens me is that now there has to be a specialty called integrative medicine. I mean, it's absurd. This is medicine. This is healing. This is healthcare. I mean, it's nice. Yes, we're all doing it together. But to me, this is what healing should be. This is it. Except we have to call it a specialty because people in their lives don't fit into 15-minute slots. People, you know, as far as I'm concerned, this is the practice of healing, what we are all doing together. So, and then finally, transdisciplinary. So we're all in this together, and the patient is at the center, and then the community as teacher. So the community as teacher means we learn from the patient and the community how to be effective. So what this means is, but it's not just something like, these are our 4 global principles. It's how we are in every moment, and can we bring this in every moment. So and remember, of course, the WHO definition of health is about a state of well-being rather than the absence of disease. And we talked about humanism, and I'm going to come back to fear in a second. So if we go back for a second to what we said we were going to talk about. So the journey for me, I just think it's important to share this, is that when I was a child, I was the only child of older parents. My dad, they're not so older now, but they were then. My father was 53 and my mother was 43. And they'd lived each in their own way, very challenging and difficult lives. But I was this little light that got born. And yeah, I mean, that was what my job was, be the little light got born. But when I was about 5, my brother, who actually dreamed of being an artist and had become a physician, he chose to end his life in our house when I was about 5. And that was rough for all of us. And then when I was about 10, my half-sister, my father had had 3 families, and I was the only child of the 3rd family. One of our half-sisters, my half-sister, became psychotic and remained that way for the rest of her life. It was kind of, I always say it's kind of like A Beautiful Mind without the Nobel Prize at the end, you know, like, but a lot of, and if we're really honest, we know people who live that life with the newspapers and in the apartments and things like that. So up until I was in my teens, I really thought that, well, if that's what happened to my brother and sister, that was what was going to happen to me. And so why shouldn't it? Psychosis, you know, maybe the best I could hope for was not depressed. You know, I mean, like, you know, if I could actually ever get there. And so then when I was in my mid-20s, I started to go through some transformational processes that really helped me realize that I could paint the painting of my life. I could be the artist of my existence. That no matter what bad things had happened to me, that I could paint my life. And once you learn to do it for yourself, I decided I wanted to learn to do it for others. And at the time, there was a training that was trying to humanize medicine. It was called Human Dimensions in Medical Education. And I went through that training. But honestly, when I was in medical school, I felt like I already knew about integrating the art and science, and that was the physician I wanted to be. But, you know, there weren't a lot of role models. There weren't a lot of role models. So I feel like for 20, 25 years here at UCSD, I used to run a course for the medical students for many years I called it stress management just to get it through the curriculum committee. It was actually teaching mind-body approaches for yourself and the patients, but it helped calling it stress management. So, now, right? Has anybody ever done that? Changed the language of what you're doing? Yes, because it's a little too threatening to the system to call it what it really is. So let's find some language that can actually end. So stress management, nobody was scared about stress. Everybody needed stress management. All right. So what I wanted to go on to, so I want to talk about fear. Fear is a very big part of our patients' lives. It's a huge issue for many, many people. It's, you know, fear that their disease will progress, fear of metastasis, fear of talking to each other. And I think that there are ways we can work with people on fear that can become part of our practice. You know, to think about something we're afraid of and then to sort of shape it and transform it. And I've had a great deal of experience now with this, with people with cancer, choosing alternative paths and looking at their fear of that and having conversations with their fear and trying to sort of, and really learning that fear can just be a little direction of where we're meant to grow, where we're meant to grow. And then in our histories, I would encourage us to take a couple of moments and think about the following questions and write personal prescriptions for people, which I've been doing for many years. And actually the first prescriptions I teach the medical students are this kind of a prescription. So before the first thing they think of giving somebody is something with a medication, think of this kind of prescription. So I want people to think about, like, you know, you all know what some of your sources of stress are. We all have them. Not that we're stressed, but that our sources of stress. That's a respectful way. Is it our marriage? Is it financial situations? Is it our life? Something, our pain, what's the source of stress? But then what are our sources of strength? And what I do with most of my patients and I've taught students to do, is to ask people about their sources of strength. What are they? Are they that you love to sing and dance? They asked me once in a radio interview what people should do to be healthier, and they thought I was going to say cholesterol and exercise. And I say, you know, people in this society don't sing and dance enough. We need to sing and dance more. Just because, you know, more traditional societies know that. You know, there's a drought, you dance. Something bad happens, you dance. You know, and in the dancing, we transform ourselves. We find the energy. So I have these dreams of art studios and half hour at lunchtime at the med school where there's either hip hop one day and salsa the next, and we just dance. You know, we dance our pain, we sing our pain, we draw our pain, we paint our joy, we draw our sadness, we experience it together. So writing a prescription with realistic goals for the things people love, because usually when we become ill or bad things happen or we're under great stress or we're moving very rapidly, we let go of those very things that are our sources of strength. If you love to run, if you love to sing, if you love to... And then I teach the students, it's very important because I think integrating spirituality, as Dr. Lewis said, integrating faith and prayer, but it's very, very important to do it, I believe, according to the faith and prayer, if that's true of the patient. So saying to the patient, what are your sources of strength? So I can remember an elderly woman, she was the night before a nephrectomy. She was going to have a kidney removed the next day. She was an elderly African-American woman at the hospital, and I was the attending, and she was in a 4-bedded room, and I went over to her, and I said, you know, she talked to me about her fear, and I said, well, what are your sources of strength? And she looked at me quizzically, and I gave her this list. You know, is it this? Is it time with your children? Is it art? Is it music? Is it science? She said, well, she says it's actually, she said, song and prayer. So I said, okay, so what's your favorite song? And she said, Amazing Grace. And I said, what's your favorite prayer? And she said, you know, the Lord's Prayer, 23rd Psalm. And actually, lo and behold, I actually know those two. I mean, you know, like, if she'd picked anything else, I probably wouldn't have known it. But so we stood there because that was her sources of strength, not my belief system, but her belief system. And we sang them, and we spoke. And then when I was leaving the room, the patient said, the people said, "Who is that woman? Who is that masked man?" You know. And one said to the other, "Is that the lady who works in the? Is that the food worker? No. Was that the volunteer? No. Was that the social worker? No." And then the patient said, "I think that was," because I was the attending, I wasn't her primary care doctor. She said, "I think that was my doctor." And all the other ladies said, "No way. You know, she's somebody else. There's no way she can be the doctor." And then an engineer who used to love photography, when he was young, he had dreamed of being a photographer, but then he had let go of it because he had become very ill trying to make his life as a photographer. And then later in life, he came as an engineer to my practice, and he just didn't feel right, that life, something was missing. And he was able to re-embrace photography and once a month go out to the desert and take photography, and it became his healing. So let me just find the button here to go to the next slide. So think about, I encourage you to think about the painting of your life. What are the colors in it? Who is in it? Children, grandchildren. We talked about sources of stress. Many behaviors that we have in our life become survival behaviors, and we're afraid to let go of them. But we can learn. We can change. So the mind, the body, and the spirit, a lot of the work I do helps people regain their ability to connect, to move past their fears, and regain their ability to connect with their deepest wisdom and to make their choices. And I provided some data slides about locus of control, like about exercise, about qigong. They're beautiful, you know, about sleep deprivation and immunity, about how beautiful views help surgical healing. There's a lot of common sense here. That maybe there's some sort of overall connection in terms of if we do things to boost our quality of life, perhaps at the same time we are boosting our immunity. We certainly know that with cervical cancer, doing things that boost our immunity or, you know, improves, then often the cells normalize and it disappears. What is going on there? And maybe, and even if we're not always curing ourselves, at least we're increasing our sense of well-being. And this was a list of patients who we could have talked about, people who've miracles that we've all seen in our lives. Another issue is to learn to do our unfinished business. My father was a great teacher for me, and towards the end of his life, he taught me very beautifully about how to do our unfinished business, to which I'm infinitely grateful. And Thich Nhat Hanh teaches that every action is an act of meditation, and that we can do that. So let's empower ourselves. Let our patients be our teachers. To be a good physician is to be thorough, compassionate, have a good knowledge base, know what we know and what we don't, and how to ask for help. And then finally, I'm going to teach you that, I'm going to talk to you about the Gandhi-Marley thing, rule of life. So Gandhi teaches, be the change you wish to see in the world, right? Be the change. But to do Gandhi, and if I could get to this little slide at the end, I'll share that with you. Gandhi teaches, be the change you wish to see in your life. But to do that, we need Marley, great philosopher. He taught in Redemption Song, emancipate ourselves from mental slavery. Only we can free our minds. To do this work, we have to free our minds. But to do that, we need to let go of fear. So Rumi, a great Muslim Sufi philosopher, taught, don't move the way fear moves you. Don't let fear prevent us from taking that next step. And what do we do with all of this? Well, we do what King taught. Injustice anywhere is a threat to justice everywhere. Even this kind of work, what I not only dream of is universal access to health care, and that the nation matures and we grow up and we realize there's a right to health care, but we realize there's a right to a kind of health care that embraces empowerment and in a humanistic model, so that people truly can transform their lives. So find an injustice somewhere and spend some time paying attention to it. They're infinite. And then, of course, Cesar Chavez taught, si se puede, we can. This today teaches us that we can. And then Hillel, from my own heritage, if I'm not for myself, who will be for me? Which means, remember, martyrs die. They land on, that's why they're called martyrs. It doesn't work to be a martyr. Find what you love. Spend a little time, whether it's time with grandchildren, music, or art. Spend a little time doing that to renew your spirit so you can be that centered healer with your patient. So you can remain remarkable, Dan Vicario and other people who work with the dying and work with people with cancer. So we can be this clinician we dream of being. And then if I'm only for myself, what am I? Well, I know about that for all of you. All of us are here because we care about these things. And if not now, when? Thank you.